Well, hello, everyone. My name is Larry Shulman. I am a medical oncologist at the University of Pennsylvania, where I'm deputy director of the Cancer Center, and I'm a former chair of the Commission on Cancer. And this is a series of interviews with former chairs. So as a former chair, I'm interviewing a former chair today, Dr. Murray Brennan. Dr. Brennan was chair of the Commission on Cancer between 1992 and 1994. He has a long and esteemed career, which I will give you just a few of the highlights of, because if I gave you all of them, it would take up all of our interview time. He trained at the Brigham and Women's Hospital in Boston, actually a place where I spent some of my career as well, and he was well known there. He is a soft tissue sarcoma surgeon and was chair of the Department of Surgery at Memorial Sloan Kettering between 1985 and 2006. He is still working at Memorial, where he is senior vice president for international programs, a place where I've been able to interact with him because I do some international work myself. And in 2000, he was the recipient of the American College of Surgeons Distinguished Service Award, their highest award. He's also a member of the National Academy of Medicine and has over 1,000 publications. So he's really one of the most esteemed leaders in cancer medicine in the U.S. with a long and illustrious career. So Dr. Brennan, maybe to start with, we can ask you how you got involved with the commission and how you became chair in 1992.
Well, I joined, as you said, in '89, and obviously by that time I was already chair at Memorial and committed to a career in cancer care. So it was a very easy transition. I'd been involved in a lot of the other college committees, and this was just a natural extension of what I was interested in. And as you know, in '92, there was about 1,300 programs, and we were at that time collecting about 70% of the cancer patients nationwide. It was the time of the AJC 4th edition, I believe, and the commission oversaw that. There was a heavy emphasis on clinical trials and a heavy emphasis on the cancer management program. And I should emphasize that that was taken internationally really by Hugo VR, because he was very fluent in Spanish and, of course, from Chile and very committed to South America. The other advance, of course, was that the college was developing the tumor board book, 160, 170 case histories, led mainly by David Winchester. And that proved to be very worthwhile. The other people on the commission at that time were very strong leaders, people like Bill Grable, John Daly, Rick Green, Glenn Steele, Marshall Urist, Bob Osteen, a lot of very strong intellectual leaders. So it was very, very easy for me to be part of the leadership of that particular group. I don't know, I think there are only 2 people from that group, or maybe 3, who ever gave the Commission on Cancer lecture more than once. Obviously, I could go on for a very long time about the strength of the commission. It was certainly an enjoyable event for myself, but most importantly, enjoyable because of the people that I was surrounded by.
Well, thanks for those thoughts. You know, a number of the people who you've mentioned subsequently became chairs of the Commission on Cancer. I'm sure following footsteps in your guidance, people like Glenn Steele and Rick Green and others who will also be interviewed during this series. But I know that you had great influence on them. You know, one of the things that happened around that time, it was really just in its embryonic stage, was the creation of the National Cancer Database. You know, that, in my own opinion, has become one of the jewels of the Commission. It's allowed us really to explore how we provide cancer care and what the outcomes are in the U.S. And have given our programs, now about 1,500 programs, a view into how they work and what their quality metrics are compared to other CoC programs. I don't know if you thought at all about those early days of the National Cancer Database, but it was, I think, one of the most important decisions the Commission made.
I couldn't agree more. And as you're aware, I've had a long-term commitment to data management and databases. I believe it was at that time that it was the NCD was created by fusion with was it the Patient Safety and Care Committee that came together with the actual database to form the National Cancer Database. I'm sure the college could refine the exact words of which two committees came together, or which committee joined with the database to make it what it became. I'm sure it would be in the minutes because it was a big deal at the time. I didn't see it, but I could go look. But I'd be very surprised if it wasn't there because, and it was called the Cancer Quality and Patient Care Committee, I think, but that would be easily found.
It's turned out, again, in my own opinion, to be one of the hallmarks of the excellence of the Commission on Cancer and what they're able to do and how they've really measured and improved quality over the years. I mean, you've been committed for your entire career in excellence of cancer care. And that certainly is your legacy in your role as chair of the Department of Surgery over many years at Memorial. And as we chatted previously, I can still remember your visit to the Brigham in the 1990s as a visiting professor and the influence that you had even in your short visit with our program at the Brigham. Again, everything was measured along the yardstick of quality. And I was wondering if you wanted to just talk a little bit about your approach to quality of care and how that's influenced your work when you were chair of the commission.
Well, I think as the recent Cancer Commission lecture, until you can measure something, you can't actually do anything about it. And historically, we as surgeons have been great numerator doctors. We remember the single success and the single failure, and we forget the denominator. And I wasn't the first person to think about that. I think Lord Kelvin talked about until you can measure something, you don't know anything. So the first step in all of this is to measure what actually happens. How can you improve something if you don't know it's good or bad? And of course, the National Cancer Database allowed that, and with the cancer programs and the emphasis on quality. So I would argue most strongly until you can actually measure your own performance, you can't do anything about it. And the second part, of course, is we're not so great at criticizing ourselves. So until you know about what your results are in your hospital, then you can't improve them. So this idea of self-criticism, I think, is a very powerful tool to improve things. It's not pejorative because you're doing it to yourself. So rather than criticizing others, I've tried hard to criticize my own efforts because then other people feel comfortable about helping change behavior.
And your influence in that regard is certainly felt. I think Deming, one of the founders of Quality of Healthcare, said, without data, you're just another person with an opinion.
Right.
And I tell that to my own on a regular basis, which I'm sure annoys them.
Yes.
But I remember not long ago talking to a group of my breast surgeons and asking them about a particular aspect of the care and whether they knew what their own performance was. And of course, all of them said, I know I do great, but I have no idea what the data are. And we got them the data, which was an interesting sociologic experiment when they saw exactly how they were doing. But you know, you've had a tremendous legacy in that regard, and we still feel it, and we're still appreciative. And I know at your own institution, which I visited, Memorial Sloan Kettering, your influence is still strongly felt. You know, the being chair of the commission, I found in my own experience is, you know, not a simple job. It's a big commitment. And you took it on at a time when you were chair of one of the largest surgical programs in the country, certainly one of the most important in cancer care, but you did it. for which we're very grateful. And I was just wondering, you know, how you view that and what your advice would be to people who might potentially have that opportunity in the future.
Well, it's a very broad question, but referring to the initial comments, you know, the truth is very hard to find. And it's very hard to establish what is true, as we've learned most recently. And it's okay to say, I don't know, but it's only okay to say, I don't know if you've done your homework. And I try to emphasize to the fellows, it's perfectly okay to say, I don't know, but I expect you've done your homework beforehand. And again, we reach back to the data. What does it actually say? We can disagree with it. Many people have talked about we can all have our own opinions, but we can't have our own data. And so if we can retreat to that, and the Cancer Commission was an opportunity to at least reinforce other people's ideas about how important it was just to know what our own and others' performance was. And of course, to help try to improve it, again, without being pejorative. Just what is the problem? How do we fix it? What can we do? How can I help? And the commission was very good at that.
Well, we're very grateful for your efforts over those many years in the commission and as chair of the commission between 1992 and 1994. I've had the pleasure of speaking with Dr. Murray Brennan from Memorial Sloan Kettering, former chair of the Commission on Cancer. Dr. Brennan, thanks so much for spending time with us today.
Thank you for your kind remarks.